All right, so I'm sitting with my sister, Dr. Jaquel Patterson. She has a office in Connecticut. What part of Connecticut?
Fairfield, Connecticut.
Fairfield, Connecticut. And she's a naturopath, and I wanted to bring her on to talk about some of the stuff she does and also talk about some aging, things that we can do, work together, and also some good information to get out to the people that are out there. So Jaquel, why don't you tell me a little bit about what you do yourself, your background, and what made you decide to get into what you're doing?
Yeah, so I'm a naturopathic physician, as you said. I practice out of Connecticut, practicing for about 16 years, have 3 Amazon best-selling books and also a Forbes contributor. And I became kind of disillusioned with the conventional medicine model pretty much when our mother got sick at 15 years of age. And I knew for me, the conventional allopathic journey was really not the one for me. And so what interested me in naturopathic medicine, also people know of it as integrative medicine or functional medicine, was that it gets to the root cause of disease and you really look at the totality of the person. So you're looking at lifestyle, diet, the mental health aspects, you're looking at like their full journey of how they came to where they are in their health condition. And so it just gravitated to me. Naturopathic doctors also spend significantly more time with patients. We're spending like 45 minutes to an hour and a half. So we really get down deep into really helping them in their healthcare path and their symptoms.
So what are some big misconceptions that I would think a lot of people have with naturopathic doctors? I know a lot of times when, not that I talk to people, a lot of people are starting to turn the page and starting to understand that there's more to just like Eastern medicine and there's other things that do help. But what are some of the biggest misconceptions you would say people have about what you do?
Mm-hmm. Yep, so if you look at like even Eastern medicine, it's over 2,000 years old. So it actually preceded the current allopathic medical model. And when you look at naturopathic physicians, there are about 26 licensed states. So that's important to know because there are some online degree programs that are like basically not credentialed, not licensed. But when you look at naturopathic medical doctors, they actually go through a 4-year accredited program. They take 2 licensing examinations and we have over 1,200 clinical hours. So we take just as much we get just as much training on the basic sciences, but we also learn the integrative medicine application to it. So I think people are aware of how extensive our training is and that we learn things on drug-herb interaction, and it's really for the safety of a patient. We're not against, conventional medicine, against medications. Lots of times we're looking at how to fuse both of them together and hopefully have people get off of, even less medications, but also that we are either taking an active partnership role or we may be leading. But we are also trained in many states, they actually prescribe as well. So I think people aren't aware of like all of our training, and there's this misconception that we're doing like, woo-woo medicine, yeah. And plant medicine is a big thing that people are doing, and there's a lot of studies on it. But a lot of how we make the decisions are based on studies. But unfortunately, there's not as much clinical studies out there for like herbs and things like that as much as you have for
I
for
think that,
medications.
like, my feeling is like there's trained doctors that actually have PhDs who've gone through it, and then there's these like voodoo doctors out there that kind of muddle the water, okay? And what I mean by that is the ayahuasca stuff and, going on these retreats. And I'm not saying they're good or bad, but some of these people are, like this, I have some friends that I make fun of, I call them shamans, But what I mean by that is like, there are some benefits to some of that stuff, but I feel like what you do and what your industry has and what people don't realize, it goes a lot deeper than just the, going into the woods on a retreat.
Exactly. Yeah, and there's a misperception. I remember when I worked in the Bronx, I was working in community health centers, doing a lot of work on like childhood obesity, hypertension, poorly controlled diabetics. And I remember working with some of the doctors and they were like, oh, you're normal. Like, they're like, you're not, a tree hugger, or there's this perception that I'm walking around with like, daisies and things in my hair and that it's not legitimate. And so I think when they get to meet me and other people that go through training, they realize like the level of credentialing and training, and that it's not just this, exactly like what you said, you're out in the woods and you're kind of making herbs. And so, I mean, we do herbs. I recommend herbs all the time, and but we're not there's all, there's different sides of us in terms of that. But
So I think like one of the biggest things that's been helpful, also it's detrimental and helpful, is social media and getting information out there. And what I mean by that is there's a lot of like things that people are starting to understand, and people are starting to turn the page at looking at, like you talked about earlier, was root causes of health issues, and I'm not gonna get into like conspiracy theory things, but everybody knows, and it's pretty clear that like Eastern medicine or modern medicine, as we know, a lot of it isn't really trying to fix the root cause. Like the money isn't. There's the saying, money isn't in the cure, right? Money's into giving you and throwing a pill down your throat. So I think we've come very far in terms of really introducing new ways to become healthier. I would like, and getting to the root core. Would you want to talk a little bit more about that?
I think one of the things in my goal working with patients is that many people, they might take medications, they get better, but they're still having the symptoms, and that's why a lot of the people that come to us, they might have autoimmune conditions, Lyme disease is one of my areas of focus, anxiety, depression, and they're still having fatigue, they're still having physical pain, but maybe their numbers have improved, but they're still having symptoms, so the quality of life is not good. And so what's important to me when I'm working with, any patients, and what we're trying to do is how do we get them into a state where they can like live, basically for lack of a better, like live their best life, like live fully, and to be able to have maybe the disease condition and move through that in a way that is optimal. It's really about like optimal functioning. And I think that that's something we forget. We're just like, okay, your numbers are good, but a patient still comes to me and they're like, I still feel horrible, even though I'm on my thyroid medication. And so what we're trying to do is really make sure that they can live their life fully.
Yeah, I mean, like for me, for example, I've been an athlete most of my life, and now I'm going to be 50 years old in a month. So now it's like, how do I transition to the next part of my life, and how do I transition in a good way? Yes, maybe I live to 85 years old, but between now and 85 years, I want to make sure that I'm not in a wheelchair. I want to make sure that I can still do most of the things and age out a good way where I'm not, on all kinds of crazy medicine and just like not living a good life. So I'm always into working out and fitness. I always talk to my guys about making sure they work, and I don't know if there's a science behind it. So is there anything about like athletes when they have injuries? Like for example, I like to train through an injury, all right? And I always tell people that the endorphins in your body will help heal injuries. And sometimes it's like one of these like weird topics, but I know personally that whenever I have an injury, and I know that if I go out and do nothing, it doesn't get better. Like I recently had a back injury. When I did nothing, it was just staying a back injury. I went in, I started rolling, doing jiu-jitsu, and now it's gone. And I've had so many injuries like that throughout my life where if I did nothing, it got worse. And then when I think about me in football in college, I would dislocate my shoulder and somehow be back the next week for a game. But the reason we were able to do that is because I was active, and it started to make sense. Like I was active. If I sat there and was at my couch, I probably would have shoulder pain for the next 5 weeks. Is there anything or any science to that, or some advice that you can, or things you can talk to about that topic?
But it's a good point, because I have athletes, and one of the challenges with athletes is they push through pain almost too much, to the point of like, we have to worry about things as we get older, arthritis and pain, issues that are going to prevent you from having like full movement throughout the whole life journey. So that's why we say when we come to exercise, I think people are still thinking of it only for weight loss and fit, and I want to look at how do I stay where I'm able to move and dance and get up, from the floor and things like that up until the end of life. And so I think as you get older too, looking at how do you change the type of exercise? Like for women, once they get into perimenopause, it should really be moving to like 50% should be weight training versus just only cardio. And how are we doing stretching and stretching more as we get older so we don't injure ourselves? So it's also realizing that during those different times in your life, you have to kind of adjust for your age too, and that we still don't have, even though I think that's one of the athlete's curses, like you still think you have the same physical body, because mentally you do, when you're 20, but how are you adjusting or accounting for that as you get older?
My question is, can you still hold on to it longer? And what I mean by that is like, when I train, especially now, I've been more focused on plyometrics, doing jumps, doing explosive movements, because I know that most people at my age can't run a sprint.
Exactly.
Right? I still can run a sprint, right? I mean, probably 3/4, but it's because I keep doing it.
You keep moving, yes.
Yeah. What is like the science behind that and making sure you stay active? Like my private clients, I'll do boxing with them, but then I also do 15 minutes of like explosive movements because I know, and I've seen it over time, guys, they take off to run, they tear their Achilles, right? And I want to try to prevent that and keep them as mobile and explosive as they can as they age. Yes, I know they're going to decline, but I just want to try to slow that decline down.
Yeah, so being active to that level, you're going to definitely slow the decline down. We want about 150 minutes per week. And if you look at the studies for people that have lived, like the blue zones that have lived up to 100, one of the biggest things is they're way more active. They're walking. Like there's something like 60 minutes to 90 minutes a day. And that could be just as effective as these HIIT workouts where we're doing it for 4 times a week. Yeah. So it's really about like that there's constant movement, and you look at there's the passion that they're always doing something that that like lights them up all the way to the end, like hobby wise. Also community, which you built with what you're doing with your gym too. But I think, but it's preventative for a lot of things. For women that are exercising more like athletes at a younger age, they're going to be less likely to have things like osteoporosis and other issues as you get older. So it definitely benefits you. You just have to be mindful of how we're keeping movement, adjusting that as we age too.
So this is what I just thought. I think, I don't know if I'm right. I remember hearing that this is the first time, maybe the last couple of years, that the mortality rate dropped, right?
Yes.
Now, that's kind of, I mean, I don't know. I mean, I'm also assuming that there's a lot of outside things that help that happen. But then on the other end, will it go back the other way? Because I feel like the generation before me is probably the first generation that actually started working out. You and I know this struggle all the time. We have parents that are in their 80s, and that generation never worked out.
Yeah,
they don't understand that. So when you talk about mortality and you're saying it's starting to drop now, do you think it will go the other direction? Like with our generation, I mean, you look like Jennifer Lopez looks, you know, she's 50 something years old. Who else? There's Halle Berry, Jennifer Aniston. These women don't look like they age,
Yes,
and it's
for
because of exercise. Do you think that mortality rate will change?
I'm hoping so. I think we're much more aware than we were before. If you look at our parents' generation, like they weren't exercising at the gym, but if you look at our father, he was physically active all the time, you know, during the day in the household and doing activities and things like that. But I think there's a lot more awareness of physical exercise, diet. I think self-care, mental health has been a big thing, but also you look at the rates of obesity have also went up higher, also matching with that, with the mortality. So I think there's seeming to be a big push. I know in my world of naturopathic medicine, functional medicine, there's a lot more doctors than like 20 years ago. Like when I went into my naturopathic medical program, when I went to Cornell undergrad as plant sciences, the only person I knew of or heard of was Dr. Andrew Weil. Now there's so many people since, Dr. Hyman, Dr. Oz, et cetera. So I definitely think that that's pushed by the consumers having an interest and need for it. So I'm hoping that that tide does change.
So what do you think? Do you think that it's just because there's so much bad food accessible that it makes it easier? But there's also a lot of information out there and a lot of people working out. Do you think it's more of a socioeconomic thing right now?
I think also access, like we're all so busy, you know, like so much busier. Time is like at a premium nowadays. So everything is for convenience. So what are we trying to do to help to support good, healthy habits that also fit into a fast-paced life? I think that's the biggest challenge now. More important, even with working at home, like, but then everyone orders, you know, things for delivery. Like, how do we arrange it so that it makes it into the lifestyle that we can adopt that's healthier for us instead of getting everything on the go? So I think that's also one of the balances we all have to kind of manage.
Yeah, I agree. I think it's like one of these situations, I'm typical at me. I'm the worst at it. It's like I live certain parts of my life healthy and then the others I don't. Or I eat very simple because it's so easy to have access to food and quick food. And then like who has the time to sit there and prep meals? So I think that's super important. We could probably go on forever, so we're gonna like cut this short. But the one thing that I want to ask is like, what kind of tips would you give for somebody to kind of live more of a fulfilling life and also like just live healthier and things to do to improve themselves?
I always just tell folks to start with like the one thing. I think in the culture, American culture, we want results fast, and I know I'm also that way. And I think what you find that works the best is what's called like the compounding effect, where you're making these small changes like, hey, I'm gonna walk every day for 30 minutes. Every day I can commit to that. Or, hey, I'm gonna start having like half my plate of vegetables, or I'm gonna consume a little bit less. And doing those in small increments. I think one of the challenges we always do is like these extremes of like, I'm eating well for a month and then we fall off the wagon and we're not good. So what I try to really focus on is like, how do we make small steps that don't feel overwhelming that we know we can actually stick to?
All right, thanks. I appreciate you coming by, and this is my first interview that I've done, and something that we're going to be doing monthly. We're going to meet with different people, sit down, talk about what they do, and how we can just get some good information out to the community. All right, thank you.
Thanks.
Yep. See you later.
Bye.